Hello, future nurses. Welcome to our NCLEX masterclass on prioritization. Are you ready to tackle one of the trickiest parts of your exam with some neat tricks and tips? Let's get started. When in doubt, remember your ABCs. That's airway, breathing, and circulation. These are the life-sustaining essentials. If a patient can't breathe, nothing else matters, right? So always address these first in any scenario. Let's explore a few examples. Now let's flip the script to CAB, circulation, airway and breathing. It's a slight twist but makes a big difference, especially in cardiac arrest situations. The idea is circulation to start the heart, airway to clear the path, and breathing to make it smart. Basically start chest compression immediately in cardiac arrest before checking the airway and breathing. So remember nurses, in most emergencies it's ABC, but for cardiac arrest, switch to CAB. It's all about the context. Keep these mnemonics in your mental toolkit and you'll be prioritizing like a pro in no time. Let's jump into a life-saving scenario. Imagine a patient in a dining hall suddenly chokes on food. There, our patient is showing the universal sign of choking, like hands collapse around the throat. What's our priority here? Airway, right? Without a clear airway, nothing else matters. Watch how our animated nurse swiftly performs the Heimlich maneuver. Key points to remember. If the patient cannot speak or cough, it's a complete obstruction and immediate action is necessary. In the second image, you can see the Heimlich maneuver being performed on a patient. And there we have it. Once the obstruction is cleared, the patient can breathe again. Always remember, in any emergency, A for airway is your number one priority. Next up, let's talk about B for breathing. Here is a patient having an asthma attack. Notice the use of accessory muscles to breathe. That's a key sign of respiratory distress. The nurses should not waste a second when administering a fast-acting bronchodilator. Here is a tip. Always have your rescue meds ready for asthma patients. And remember, effective breathing can be the difference between life and death. Now let's address a C for circulation with the heart attack scenario. The patient depicted in the presentation is exhibiting classic symptoms of heart attack, that is chest pain and sweating. Time is crucial in a heart attack. It is important for the nurses to quickly administer aspirin and initiate an ECG. And here is a crucial point. Always be prepared to perform CPR if circulation stops. With prompt action, the patient is stabilized. Remember, in circulatory emergencies, every second counts. So stay alert and prepared to act immediately. Moving forward, let's talk about the use of Maslow's hierarchy in nursing. Maslow's not just a psychology thing. In nursing, we use it to prioritize care, from physiological needs at the base up to self-actualization at the top. And remember, physiological needs first, safety second. And then love your patient's social needs, esteem their mental health, and strive for holistic care. First, starting at the base, we have physiological needs, the essentials for survival. Picture this, a diabetic patient with hypoglycemia. What do they need first? You got it, a quick sugar fix. So this layer is all about meeting those critical life-sustaining needs. Next up, safety needs. It's all about feeling secure. Imagine ensuring a clean, fall-proof room for a post-operative patient. Why? Because safety isn't just a policy, it's a nursing promise to our patients. Now to the heart of the pyramid, love and belonging. Think about arranging a heartwarming family visit for a lonely patient. It's not just medical care, it's about nurturing the human spirit. That's nursing with heart. Moving up, we have esteem needs. Picture this, a patient beams with pride after walking post-surgery. Your encouragement as a nurse boosts their confidence. It's about celebrating small victories on the road to recovery. And at the top, self-actualization. Imagine helping a patient set goals for life post-recovery. It's about empowering them to envision a future beyond illness. As nurses, we don't just heal bodies, we inspire futures. Welcome to Triage 101. It's being like in the control tower of a bustling airport where each decision guides a safe landing. Each setting in a nursing has its unique rhythm. Triage is the art of decision making under pressure. Today we are exploring the 5 levels of triage. Let's jump in. Level 1, immediate. This is the top priority. We are talking about life-threatening emergencies like cardiac arrest. These patients need help now. Next, level 2, emergent. Serious but not quite immediate. Think severe pain or potential complications. They need quick action, but there is a small window for intervention. Level 3, urgent, is where we see conditions like broken bones. They hurt and need care, but it's not a race against time. Moving to level 4, semi-urgent. Here it's about discomfort more than danger. Sprains, mild asthma, important, but they can wait a bit. And finally, level 5, non-urgent. The walking wounded patients with small cuts or cold symptoms, they'll be fine for a while, so we can see them last. Now we are going to explore triage further with some real world scenarios. Number 1, emergency room. Imagine three patients in the ER, one with one clutching their chest, another with the broken arm, and a third with a small cut. Who needs immediate attention? What do you think? That's right, the chest pain patient. ER triage is about swift and smart choices. Scenario number 2, disaster response. When disaster strikes, triage is our superpower. From severe bleeding to sprains and scrapes, it's about prioritizing who needs us most. Think fast, act faster. That's the triage mantra in a disaster. Number 3, primary care. Primary care triage isn't about the hustle and bustle, but it's no less crucial. It's where acute asthma fights for air against routine physicals. Here, triage is about balancing urgency with importance, one patient at a time. So remember, in triage, it's not just about who's first, but who needs you most. Remember, in the world of triage, you are the guardian of time and care. Now, as we navigate the crucial art of prioritization, let's not forget about another key skill in our nursing toolkit, that is delegation. It's all about knowing who can do what. As a nurse, you will lead a team, and leading means delegating tasks based on each team member's skills and scope of practice. For instance, complex assessments or critical decision making are typically RN's field. An LPN handles medication administration while a UOP could assist with basic care, right? But wait, there is more. If you are eager to dive deeper into the hows and whys of delegation, we have got just the thing for you. Check out our detailed video on delegation in this playlist. It's a full of nursing scenario, do's and don'ts, mnemonics, practical tips to turn you into a delegation pro. You can find the link in the description below. Now let's circle back to prioritization, and when you are ready, the delegation video is waiting to give you the full scoop. Now let's get back to our discussion on prioritization. Now we are breaking down prioritization into easy to remember tips. Get ready to ace those NCLEX questions. Tip number 1, ABCs first. Remember, ABCs always come first. Airway, breathing, circulation. They are your top priorities in patient care. Tip number 2, safety is key. After ABCs, think safety. Make sure your patient is safe from any harm. It's that simple. Tip number 3, Maslow's hierarchy. Use Maslow's hierarchy as your guide. Start with basic needs like food and safety and then move up the pyramid. Tip number 4, look for keywords. Keep an eye out for keywords in questions. Words like best, first, the most important are big hints. Tip number 5, urgent versus important. Learn to tell what's urgent from what's important. Urgent issue needs immediate attention. Tip number 6, stable versus unstable. Focus on unstable patients first. If they are stable, they can wait a bit longer. Tip number 7, pain management. Manage pain, but no, it's not just always the first priority, except for the chest pain. Sure. Tip number 8, infection control. Preventing infections is crucial, especially for patients with weak immune systems. Tip number 9, delegation and scope. Know what task you can delegate. It helps manage your workload effectively. Tip number 10, chronic conditions. Don't overlook patients with chronic condition. They need attention too. Tip number 11, clinical judgment. Use your judgment. Think about the effects of each choice you make. Tip number 12, lab values. Know your lab values. I mean, they help identify which patient need more urgent care. Tip number 13, time management. In procedures, think about which action needs to be done first. Tip number 14, client education. Client education is important, but first address any urgent health needs. Then tip number 15, practice makes perfect. The more you practice, the better you will get at prioritization. Number 16, trust your training. Trust your nursing instincts. Often your first choice is the right one. And tip number 17 and last, don't overthink. Keep it simple on the NCLEX. Don't overcomplicate, don't overthink the questions. And there you have it. Easy and clear tips for NCLEX prioritization. Keep these in mind and you will do great. Alright everyone, let's step into the shoes of a nurse handling a COPD crisis. We have got a 55-year-old patient with worsening breathlessness, cough and fever. Oxygen levels are down and the lungs don't sound too happy. Plus, there is a hint of infection brewing. Okay, our mission here is to manage the COPD exacerbation. We have got a list of actions here. Although all options might look correct, but not all of them are top priority right now. Let's figure out which steps to take first. And remember, it's all about what the patient needs urgently. Alright everyone, let's pause the video for a minute and try to answer the question based on what you have learned about COPD management and prioritization. Think about the most immediate needs for this patient. When you are done, we will discuss the rationale together. Great, let's check your answers. Options 1, 2, 3, 7 and 8 are correct ones. Congrats if you got that right. If you don't worry because now we are gonna break down our answer for a clearer understanding. Option 1. Administering supplemental oxygen is crucial to improve the patient's oxygen saturation levels, especially when they are as low as 88%. We need to get the number up to 92% to ensure adequate oxygenation. Option number 2. IV corticosteroids are key in reducing lung inflammation, a common issue in COPD flare-ups. Next one is broad spectrum antibiotics. Tackle any underlying infection as indicated by the elevated white blood cell count. Nebulized bronchodilators help open up those airways, making it easier for our patient to breathe. And monitoring ABGs gives us real-time data on the respiratory status, including oxygenation and acid-base balance. So those are the right options. Now for the options we didn't choose, number 4, 5, 6 and 9. 4 and 5, incentive spirometry and chest physiotherapy are indeed part of COPD management, but they come into play after we have stabilized the patient's immediate respiratory needs, right? Number 6, preparation for intubation is a critical step, but it's more of a precautionary measure for severe cases. Our patient isn't there yet. And number 9, educating the patient on smoking cessation is vital for long-term health and preventing further exacerbations. However, during an acute flare-ups, the focus is on immediate treatment and stabilization, right? So always remember, in acute flare-ups, focus on immediate life-sustaining interventions first. The rest, while important, follows once the patient is stable. Great job in sorting through these options. That is what prioritization in nursing is all about. Alright, you have got this. Prioritization is about saving lives and making critical decisions. For more helpful NCLEX insights and strategies, don't forget to follow Educated Nursing Review classes. Together, we will ensure you are fully prepared to excel in your exams. Keep practicing, keep learning, and remember, you are going to be fantastic nurses. Until next time, keep prioritizing and stay awesome. Bye for now.